51. What does a PR interval longer than 0.2 seconds indicate? A. First degree AV block. B. Second degree AV block. C. Third degree AV block. D. Atrial fibrillation. Answer: A. First degree AV block. Rationale: a prolonged PR interval longer than 0.2 seconds is indicative of a first degree AV block, where there is delayed conduction between the atria and ventricles. Second and third degree AV blocks have more severe disruptions in conduction. 52. What is the characteristic ECG finding in Wolff-Parkinson-White syndrome? A. Prolonged PR interval. B. Delta wave. C. QRS complex greater than 0.12 seconds. D. ST segment depression. Answer: B. Delta wave. Rationale: Wolff-Parkinson-White syndrome is characterized by the presence of a delta wave, which is a slurred upstroke of the QRS complex due to an accessory pathway that bypasses normal AV nodal conduction. 53. In an ECG, what does the T wave represent? A. Atrial depolarization. B. Ventricular repolarization. C. Atrial repolarization. D. Ventricular depolarization. Answer: B. Ventricular repolarization. Rationale: the T wave represents ventricular repolarization, which is the process of the ventricles returning to their resting state after depolarization. Atrial depolarization is represented by the P wave. 54. What would be the most likely ECG finding in hypothermia? A. T wave inversion. B. Osborn waves. C. Prolonged PR interval. D. Shortened QT interval. Answer: B. Osborn waves. Rationale: Osborn waves, or J waves, are characteristic of hypothermia and are seen as small upward deflections at the junction of the QRS complex and ST segment. They are not typically associated with T wave inversion, prolonged PR intervals, or shortened QT intervals. 55. What is the primary ECG finding in second-degree AV block, type 2? A. Prolonged PR interval. B. Dropped QRS complex. C. Progressive lengthening of PR interval. D. Irregular RR intervals. Answer: B. Dropped QRS complex. Rationale: in second-degree AV block type 2, also known as Mobitz type 2, there is a consistent PR interval, followed by a dropped QRS complex. This differs from type I, which has progressive PR interval lengthening. 56. What is the primary characteristic of right bundle branch block, RBBB, on an ECG? A. Widened QRS complex. B. Inverted T waves. C. Left axis deviation. D. Peaked P waves. Answer: A. Widened QRS complex. Rationale: right bundle branch block is characterized by a widened QRS complex greater than 0.12 seconds and an altered pattern of ventricular depolarization. This condition can also result in an altered shape of the QRS complex, but the primary characteristic is the widened QRS. 57. What does a QT interval longer than 0.44 seconds generally indicate? A. Increased risk of arrhythmias. B. Normal heart rate. C. Myocardial infarction. D. Heart failure. Answer: A. Increased risk of arrhythmias. Rationale: a prolonged QT interval increases the risk of arrhythmias such as torsades de pointes, which can lead to sudden cardiac arrest. A normal QT interval typically ranges from 0.36 to 0.44 seconds, depending on heart rate. 58. What ECG finding is indicative of a possible myocardial infarction in the anterior leads V1, V4? A. ST segment elevation. B. ST segment depression. C. T wave inversion. D. Prolonged PR interval. Answer: A. ST segment elevation. Rationale: ST segment elevation in leads V1, V4 is suggestive of an anterior myocardial infarction where the heart muscle is deprived of oxygen and starts to die. This pattern is distinct from ST segment depression, which is seen in ischemia. 59. Which of the following ECG findings would you most likely find in left ventricular hypertrophy? A. Tall R waves in lead V1. B. Prolonged PR interval. C. Right axis deviation. D. Deep S waves in lead V5. Answer: A. Tall R waves in lead V1. Rationale: in left ventricular hypertrophy, there are often tall R waves in lead V1 and deep S waves in lead V5 or V6. This pattern reflects the increased muscle mass of the left ventricle. Other options are not as strongly associated with this condition. 60. In the case of supraventricular tachycardia, SVT, which ECG finding is commonly observed? A. Rapid, regular rhythm with narrow QRS. B. Irregularly irregular rhythm with no P waves. C. Wide QRS complex. D. Variable PR interval. Answer: A. Rapid, regular rhythm with narrow QRS. Rationale: supraventricular tachycardia, SVT, is characterized by a rapid, regular rhythm with a narrow QRS complex. It often results from reentrant circuits above the ventricles. The rhythm is usually regular and does not have wide QRS complexes. 61. Which of the following is the most characteristic finding in ventricular tachycardia on an ECG? A. Narrow QRS complex. B. Regular, wide QRS complexes. C. Sinus rhythm. D. Irregular RR intervals. Answer: B. Regular, wide QRS complexes. Rationale: ventricular tachycardia typically presents with wide, regular QRS complexes at a rapid rate, distinct from the narrow QRS complex seen in normal sinus rhythm. 62. What ECG finding is commonly associated with hypercalcemia? A. Prolonged QT interval. B. Shortened QT interval. C. Peak T waves. D. Inverted P waves. Answer: B. Shortened QT interval. Rationale: hypercalcemia shortens the QT interval because of faster repolarization of the ventricles. The other choices are not directly linked to hypercalcemia. 63. What is a possible complication of second-degree AV block type 2? A. Complete heart block. B. Bradycardia. C. Tachycardia. D. Ventricular fibrillation. Answer: A. Complete heart block. Rationale: second-degree AV block type 2, Mobitz 2, can progress to complete heart block, third-degree AV block, where no electrical impulses are conducted from the atria to the ventricles. 64. Which ECG change would most likely be seen in acute pericarditis? A. Concave ST segment elevation. B. QRS complex widening. C. Prolonged PR interval. D. U waves. Answer: A. Concave ST segment elevation. Rationale: acute pericarditis commonly presents with concave, upward, ST segment elevation in most leads, not a widened QRS complex or prolonged PR interval. 65. Which of the following is a classic ECG feature of Wolff-Parkinson-White, WPW syndrome? A. Prolonged PR interval. B. Delta wave. C. Inverted T waves. D. ST segment depression. Answer: B. Delta wave. Rationale: WPW syndrome is characterized by a delta wave, which is a slurred upstroke in the QRS complex due to an accessory pathway. This is distinct from a prolonged PR interval. 66. Torsades de pointes is a type of ventricular tachycardia that is commonly caused by what? A. Hyperkalemia. B. Prolonged QT interval. C. Hypertension. D. Sinus arrhythmia. Answer: B. Prolonged QT interval. Rationale: torsades de pointes is a life-threatening arrhythmia that often occurs due to a prolonged QT interval, which can be drug-induced or electrolyte-related. 67. Which of the following is the most likely ECG finding in left atrial enlargement? A. Tall, peaked P waves. B. Prolonged PR interval. C. Biphasic P waves. D. Inverted T waves. Answer: C. Biphasic P waves. Rationale: left atrial enlargement is commonly associated with a biphasic or notched P wave, especially in leads 2 and V1, due to the prolonged conduction time as the left atrium enlarges. 68. What does a wide QRS complex with sawtooth pattern in lead 2 suggest? A. Atrial fibrillation. B. Atrial flutter. C. Ventricular fibrillation. D. Right bundle branch block. Answer: B. Atrial flutter rationale. A sawtooth pattern in lead 2 is characteristic of atrial flutter, where rapid atrial depolarization causes a series of flutter waves. It differs from the irregular rhythm of atrial fibrillation. 69. Which of the following is a primary concern when managing a patient with third-degree AV block? A. Bradycardia. B. Tachycardia. C. High blood pressure. D. Risk of sudden cardiac arrest. Answer. D. Risk of sudden cardiac arrest rationale. Third degree, complete, AV block results in complete dissociation between atrial and ventricular activity, leading to a slow ventricular rhythm. This greatly increases the risk of sudden cardiac arrest if untreated. 70. Which of the following is a hallmark of hyperkalemia on an ECG? A. Tall, peak T waves. B. Prolonged PR interval. C. Shortened QT interval. D. Wide QRS complex. Answer. A. Tall, peaked T waves rationale. Hyperkalemia is characterized by tall, peaked T waves on the ECG, which occur as a result of elevated potassium levels affecting the repolarization of the ventricles. 71. Sinus tachycardia is characterized by which of the following ECG findings? A. Regular rhythm, heart rate greater than 100 bpm. B. Irregular rhythm, heart rate less than 60 bpm. C. Rapid, wide QRS complexes. D. No P waves. Answer. A. Regular rhythm, heart rate greater than 100 bpm rationale. Sinus tachycardia presents with a regular rhythm and a heart rate greater than 100 bpm, with normal P waves and QRS complexes. 72. A U wave seen on an ECG is most commonly associated with which condition? A. Hyperkalemia. B. Hypokalemia. C. Left ventricular hypertrophy. D. Atrial fibrillation. Answer. B. Hypokalemia rationale. U waves are most commonly seen in hypokalemia, reflecting delayed repolarization of the ventricles. They are not typically seen in hyperkalemia or other conditions listed. 73. What ECG finding is indicative of right ventricular hypertrophy? A. Right axis deviation. B. Tall R waves in V1. C. Left axis deviation. D. Widened QRS complex. Answer. B. Tall R waves in V1 rationale. Right ventricular hypertrophy often presents with tall R waves in V1 and right axis deviation due to the increased muscle mass in the right ventricle. 74. Which of the following findings is most likely in acute myocardial infarction, MI? A. T wave inversion. B. ST segment depression. C. ST segment elevation. D. P wave inversion. Answer. C. ST segment elevation rationale. Acute MI commonly shows ST segment elevation, especially in the leads that correspond to the affected area of the heart, indicating myocardial injury. 75. Which condition is often associated with a prolonged PR interval on an ECG? A. Sinus bradycardia. B. First-degree AV block. C. Right bundle branch block. D. Ventricular fibrillation. Answer. B. First-degree AV block rationale. A prolonged PR interval, greater than 0.20 seconds, is a hallmark of first-degree AV block, where conduction from the atria to the ventricles is delayed but still consistent. 76. Atrial fibrillation on an ECG would most likely present with which of the following? A. Regular rhythm, heart rate less than 100 bpm. B. Irregularly irregular rhythm. C. Wide, bizarre QRS complexes. D. Prolonged QT interval. Answer. B. Irregularly irregular rhythm rationale. Atrial fibrillation is characterized by an irregularly irregular rhythm with no distinct P waves, and the ventricular rate is often rapid and variable. 77. What is a common finding in Brugada syndrome on an ECG? A. Prolonged QT interval. B. Elevated ST segment in leads 2, 3, and AVF. C. Right bundle branch block pattern. D. Slurred upstroke in QRS. Answer. C. Right bundle branch block pattern rationale. Brugada syndrome is associated with a characteristic right bundle branch block, RBBB, pattern and ST segment elevation in leads V1, V3, often leading to an increased risk of sudden cardiac death. 78. In left bundle branch block, LBBB, what is the expected ECG finding? A. Prolonged QRS duration. B. Peaked P waves. C. Widened T waves. D. Elevated ST segment. Answer. A. Prolonged QRS duration. Rationale. LBBB is characterized by a prolonged QRS duration greater than 0.12 seconds due to delayed conduction in the left bundle branch. 79. What does a QR pattern in lead V1 suggest? A. Right ventricular hypertrophy. B. Myocardial infarction. C. Pulmonary embolism. D. Left bundle branch block. Answer. A. Right ventricular hypertrophy. Rationale. A QR pattern in lead V1 with a deep Q wave and a small R wave is often associated with right ventricular hypertrophy due to increased muscle mass in the right ventricle. 80. Which of the following is a key sign of hypothermia on an ECG? A. Shortened QT interval. B. Osborne waves. C. Prolonged PR interval. D. ST segment depression. Answer. B. Osborne waves. Rationale. Osborne waves, also known as J waves, are commonly seen in patients with hypothermia. They represent a positive deflection at the junction between the QRS complex and ST segment. 81. What does ST segment depression typically indicate on an ECG? A. Myocardial ischemia. B. Ventricular hypertrophy. C. Pulmonary embolism. D. Atrial fibrillation. Answer. A. Myocardial ischemia. Rationale. ST segment depression is a common indicator of myocardial ischemia, often seen during exercise or as a result of reduced blood flow to the heart. 82. What ECG change is most commonly associated with hyperkalemia? A. Flattened T waves. B. Prolonged PR interval. C. Tall, peaked T waves. D. Inverted P waves. Answer. C. Tall, peaked T waves. Rationale. Hyperkalemia is commonly characterized by tall, peaked T waves, which occur due to increased potassium levels affecting the repolarization phase of the cardiac cycle. 83. What is the expected ECG finding in ventricular fibrillation? A. No identifiable QRS complexes. B. Regular, wide QRS complexes. C. Sinus rhythm. D. Inverted P waves. Answer. A. No identifiable QRS complexes. Rationale. In ventricular fibrillation, the electrical activity in the heart is chaotic and no identifiable QRS complexes are seen on the ECG, making it life-threatening. 84. Which ECG finding is characteristic of atrial flutter? A. Sawtooth-shaped P waves. B. Prolonged PR interval. C. Regular, wide QRS complexes. D. No P waves. Answer. A. Sawtooth-shaped P waves. Rationale. Atrial flutter is characterized by rapid, sawtooth-shaped P waves due to the atria beating very quickly, while the ventricular response is usually regular. 85. What is the most likely cause of prolonged PR interval? A. First-degree AV block. B. Hyperkalemia. C. Atrial fibrillation. D. Second-degree AV block. Answer. A. First-degree AV block. Rationale. A prolonged PR interval greater than 0.20 seconds is a hallmark of first-degree AV block, which occurs due to delayed conduction from the atria to the ventricles. 86. What is the significance of a Q wave seen on an ECG? A. Ventricular hypertrophy. B. Myocardial infarction. C. Hyperkalemia. D. Right bundle branch block. Answer. B. Myocardial infarction. Rationale. A pathological Q wave indicates myocardial infarction as it reflects the area of the heart muscle that has died or is infarcted, which causes a permanent loss of electrical activity. 87. What is a common ECG finding in left atrial enlargement? A. Tall P waves. B. Biphasic P waves. C. Prolonged PR interval. D. Widened QRS complexes. Answer. B. Biphasic P waves. Rationale. Left atrial enlargement is commonly associated with a biphasic, or notched, P wave, especially in leads 2 and V1, due to the prolonged conduction time as the left atrium enlarges. 88. In which condition is a shortened QT interval most commonly seen? A. Hyperkalemia. B. Hypercalcemia. C. Hypokalemia. D. Pulmonary embolism. Answer: B. Hypercalcemia. Rationale: a shortened QT interval is commonly associated with hypercalcemia because the increased calcium levels cause faster repolarization of the ventricles. 89. What does right axis deviation on an ECG most likely indicate? A. Left ventricular hypertrophy. B. Right ventricular hypertrophy. C. Acute myocardial infarction. D. Pulmonary embolism. Answer: B. Right ventricular hypertrophy. Rationale: right axis deviation is often seen in conditions such as right ventricular hypertrophy, which occurs when the right side of the heart is overworked and enlarged. 90. What is the primary cause of sinus bradycardia? A. Increased vagal tone. B. Myocardial infarction. C. Hyperthyroidism. D. Electrolyte imbalance. Answer: A. Increased vagal tone. Rationale: sinus bradycardia is commonly caused by increased vagal, parasympathetic, tone, which slows down the heart rate. It can also occur in well-trained athletes. 91. Which ECG finding is indicative of ventricular tachycardia? A. Wide, bizarre QRS complexes. B. Regular P waves with long PR intervals. C. Irregularly irregular rhythm. D. Normal QRS with T-wave inversion. Answer: A. Wide, bizarre QRS complexes. Rationale: ventricular tachycardia is characterized by wide, bizarre QRS complexes that occur at a rapid rate, often without a preceding P wave. 92. What is the most likely ECG finding in hypothermia? A. Osborne waves, J waves. B. Tall, peak T waves. C. Prolonged QT interval. D. T-wave inversion. Answer: A. Osborne waves, J waves. Rationale: Osborne waves, J waves, are characteristic of hypothermia and represent an early depolarization of the myocardium. 93. In first-degree AV block, what is the expected ECG finding? A. Normal PR interval. B. Prolonged PR interval. C. No P waves. D. Wide QRS complex. Answer: B. Prolonged PR interval. Rationale: first-degree AV block is characterized by a prolonged PR interval, which is greater than 0.20 seconds, indicating delayed conduction from the atria to the ventricles. 94. Which of the following ECG findings suggests atrial fibrillation? A. Regular rhythm, with uniform P waves. B. Irregularly irregular rhythm. C. Sawtooth P waves. D. Prolonged QRS complex. Answer: B. Irregularly irregular rhythm. Rationale: atrial fibrillation is characterized by an irregularly irregular rhythm with no distinct P waves, and the ventricular response is often rapid and variable. 95. Which of the following ECG findings is a hallmark of Wolff-Parkinson-White syndrome? A. Prolonged PR interval. B. Delta wave. C. QRS complex inversion. D. T-wave flattening. Answer: B. Delta wave. Rationale: Wolff-Parkinson-White syndrome is characterized by a delta wave, which is a slurred upstroke in the QRS complex due to an accessory pathway that allows faster conduction. 96. What ECG change is most indicative of hypokalemia? A. U waves. B. Peaked T waves. C. Flattened P waves. D. Prolonged PR interval. Answer: A. U waves. Rationale: hypokalemia is often associated with the appearance of U waves, which occur due to delayed repolarization of the ventricles. 97. What is the most common ECG finding in right bundle branch block, RBBB? A. Prolonged QRS duration. B. Delta wave. C. Right axis deviation. D. Wide QRS complex with an R wave. Answer: D. Wide QRS complex with an R wave. Rationale: RBBB is characterized by a wide QRS complex greater than 0.12 seconds with a notched or double R wave. R. In lead V1. 98. What is a common ECG finding in myocardial infarction, MI? A. ST segment elevation. B. Prolonged PR interval. C. T-wave flattening. D. Delta wave. Answer. A. ST segment elevation. Rationale. ST segment elevation is a hallmark of acute myocardial infarction, MI, and signifies myocardial injury. It is seen in the leads corresponding to the affected region of the heart. 99. What is the most significant ECG feature of complete heart block, third-degree AV block? A. No P waves. B. No QRS complexes. C. Dissociation between atrial and ventricular rhythms. D. Shortened QD interval. Answer. C. Dissociation between atrial and ventricular rhythms. Rationale. In third-degree AV block, the atria and ventricles beat independently, leading to a complete dissociation between atrial and ventricular rhythms. 100. Which of the following ECG findings is most characteristic of hyperthyroidism? A. Sinus tachycardia. B. Prolonged PR interval. C. Left axis deviation. D. Shortened QD interval. Answer. A. Sinus tachycardia. Rationale. Sinus tachycardia is commonly seen in hyperthyroidism due to the increased metabolic rate and sympathetic nervous system activity.